Good afternoon, everyone, and welcome to this afternoon's webinar featuring a special guest speaker, Craig Thompson from the Ontario Patient Ombudsman's Office. Now, on the back end, we're just taking a moment to make sure that our presenters are good to go. But in the meantime, as I said, I'm going to welcome everyone this afternoon. I'm Sam Peck. I'm the Executive Director of Family Councils Ontario. Before we kick off, just to acknowledge the traditional territories on which we are meeting and the various Indigenous peoples whose land we are privileged to meet, learn, and connect on as members of settler and non-settler populations on Turtle Island. I'm coming to you from Hamilton, Tiffany from Mississauga, and our panelists from the GTA area as well. And specifically, where I'm coming from, the city of Hamilton is on the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas, and it's covered by the District 1 Spoon Wampum Belt Covenant. And what this means is it's really an agreement originally between the Haudenosaunee and the Shinabak to share and care for the resources around the Great Lakes. And today our cities are home to many Indigenous peoples across Turtle Island, North America. And part of what we do as peoples and strive to do is to engage in reconciliation. And that's what this land acknowledgement is part of, and acknowledging the first occupants of this land, and that these Indigenous peoples are part of our community and that we can learn a lot from as we work with them. So we should all be taking a moment to reflect how this plays out in our work and our day-to-day lives as partners with Indigenous communities. This afternoon's webinar is titled Updates from Patient Ombudsman. And specifically, Craig Thompson, who is the Patient Ombudsman, will share information about a new COVID-19 experience survey for caregivers and families, provide an update on the office's investigation into COVID-19 outbreaks, provide you some information and education on the types of complaints that the Patient Ombudsman Office can receive from caregivers and residents, and also provide an opportunity to ask your questions. Craig Thompson is the newest and current Patient Ombudsman. He has over 25 years experience working for public and private organizations in healthcare, design services, and communications. He's the past co-chair of the Patient Experience Steering Committee at Cancer Care Ontario, and past chair and board member of Progress Place, a community mental health organization. As the Executive Director of Family Councils of Ontario, I've had the privilege to work with Craig in his previous role with the Patient Ombudsman's Office, and I am looking forward to future opportunity to work together. I do believe that Craig and his office bring a lot of experience to the table, but also a commitment to and understanding of the value that the role that families play in the long-term care sector, and how your experiences, concerns, and challenges can be elevated to a systems level to improve the living, working, and caring conditions across Ontario's long-term care sector. I'm going to turn it over to my colleague now, Tiffany, to go over a few housekeeping things with you. But thank you so much for joining us this afternoon. Over to you, Tiff.
Perfect. Thank you, Sam. Good afternoon and welcome, everyone. Thank you so much for joining us today for a special guest webinar. As Sam mentioned, my name is Tiffany Fearon, and I am the Client Services and Communications Manager at FCO. Before we hand the floor over to our special guests, we just wanted to cover a few housekeeping items. So firstly, all attendees will be muted. We also ask that everyone joining, make sure that you're muting your microphones just in case we get any background noise. We know that tech can be unpredictable. So we just want to make sure that we're preserving the sound quality. Also, in the interest of time, we do ask that all questions or comments be typed into the chat box that you'll see on the right-hand side. At the end of the presentation, any questions and comments posed to Craig, we'll be reading those aloud to get his feedback and some insights as well. So we will do our best to try to get to as many as possible. Now that I believe we've covered the most important items, it is my pleasure to introduce our guests, Ontario's Patient Ombudsman, Craig Thompson. Samantha gave him a great introduction already, but he has definitely been quite a healthcare leader. So we're happy to turn the floor over to you. Please feel free to share your screen when ready.
Thank you, Tiffany, and thank you, Sam, for that, for the introductions. And really wanted to say how happy I am to be once again speaking with the Family Councils Ontario. As Sam said, we have collaborated in the past and have spoken to various family councils over the years. So this really is a wonderful opportunity for us to share a little bit of updates about our office, but also to learn more from you and the family councils across the province as to what kinds of issues that you're seeing. And whether there's some role for our office to assist and support you in those resolving those issues. I'm also being supported today on this webinar with another member of my team, Jason Oliver. So Jason, if anytime I have issues with trying to answer a particular question, Jason will be there to assist me. So I'm going to. We do have a bit of a slide deck just to keep me on track and make sure I cover all the material. I'll go to share this slide now, and then you can let me know if it's actually working correctly. And do you see slide 1?
Yes, it looks good, Craig. Thank you.
I'm just going to go to present mode, and just not sure if it's going to. Do you see the larger picture, or this? Oops.
You can see the larger picture now. It looks perfect.
Okay, great. All right, so I'll start into this. As I said, this is going to be a bit of soup to nuts, because we're going to do a little bit of update on our office, talk a little bit about what our mandate is and what it is that we can do for families and caregivers with residents in long-term care, and also going to talk a little bit about our first report that came out of wave 1 of COVID-19, give you a little bit of an update on the investigation that we have underway in long-term care, and as Sam mentioned, to introduce you to the province-wide survey that we're now running, targeting residents, families, caregivers, and staff within long-term care to get their insights to inform our investigation. So quite a few things to cover, and so I'll get started. So just a bit of background about our jurisdiction, or who we have oversight within the within the healthcare system. Obviously, we have oversight within long-term care homes, of which there are 630 plus long-term care homes, but we also have jurisdiction over the 141 public hospitals and home and community care support services. So that's a large portion of the healthcare system, but it's not the entire healthcare system. So everyone probably recognizes that in our interactions with the healthcare system, we may come in contact with public hospitals, long-term care homes, and home and community care, but we also have interactions with our GPs in terms of our general practitioners, other laboratory services, a whole myriad of other kinds of healthcare settings. Those are not within our jurisdiction. Those are typically within the jurisdiction of the Ontario Ombudsman, but we do have oversight over a large portion of the healthcare system. And for this audience, because we have a jurisdiction over long-term care homes, this is the area of interest and what we'll be talking about mostly today. So what is an ombuds? What is a patient ombudsman? This is a question we get quite often. The concept of an ombudsman is not entirely known broadly within society. So it's always good for us to sort of do a little bit of a refresher as to what it is that our office mandate is about, and also what it is that we can do to help Ontarians. So we offer a free complaints resolution service to all Ontarians within the healthcare setting. So what we do is we hear concerns, complaints, hear about issues from patients or residents or their caregivers about a negative healthcare experience that they may have had. And so that negative healthcare experience really is a broad spectrum of different concerns that would come to our office. And I'll go through a little bit later in today's talk about what some of those concerns, complaints, issues look like, just so you have a sense of what it is that we deal with. But it's really quite a broad area of jurisdiction. And we work with all sides to determine a meaningful resolution. So we are in the business of what we call fairness. So we are really in the balancing act of balancing the interests of not only the patient, the resident, and or their families, but also the organizations that are serving those individuals. So we're really trying to find that middle ground so that we come to resolutions that are, first of all, meaningful, but also fair when it comes to both sides in terms of both parties. We're often asked the question, because we're called the Patient Ombudsman, are we advocates for patients? And we are not advocates for patients, because advocacy inherently means that we are working to advance the interests of one particular side. But an ombuds, in our classic role, we are in that balancing act of working not only for the residents, the patients, the families, but also for those organizations to find those resolutions that are fair and meaningful. We do that the resolution process in what I'll call is an informal way. So we really find that the best resolutions are the ones that come to when we're starting a conversation, working with the various parties to understand what the issue is, what's the core underpinnings of that issue, and then working to a resolution that satisfies ideally both parties in a very informal way. But ultimately, there are those particular concerns or complaints that come to our office that would merit a formal investigation. And we, as an office of ombudsman, are able to initiate formal investigations so that we can dive a little bit deeper into what are the issues in play related to this complaint. And so also that we can make formal recommendations, not only to the organizations, but also to the families and the system overall, because ultimately, while we want to be able to resolve individual complaints and help individual patients and residents or their families, we also want to be able to inform systemic change. The whole system should hopefully benefit by us doing the work of resolving individual complaints. So that's ultimately some of what goes into our decision to actually launch a formal investigation, is if we can see a broader interest for us going deeper and understanding it, the issues better. We are also often referred to as an office of last resort, which always sounds sort of sinister, or like we're at the end of the road. But what that really means is that we require that a complaint first goes to the organization to allow them a chance to actually deal with the issue in direct contact with the complainant. And we do this because we know that the best resolutions occur where the complainant is able to have a good relationship and a frank discussion with the organization where they're getting the service. That's where the relationship lies. And the last thing that we want to do is to come between those relationships, because as we know in healthcare, and particularly in long-term care, these organizations provide a service that is quite intimate. Long-term care is where these are people's homes, and so that relationship must be sustained, because it will be there. It was there before we came onto the scene. It'll be there after we are finished with our work. So we really want to make sure that we reinforce those relationships, and so that's why we're called offices of last resort, we really will encourage you to have that complaint taken up first with the organization. If it turns out that you come to our office and you have not had an opportunity to deal with that organization, then we will work to reconnect you with the proper people at the long-term care home so that you can have those discussions. And as I said earlier, we look into the fairness of a situation. So we have what we call a methodology for looking at fairness. We look at fairness from three lenses. One is the lens of the relationship. The other is the lens through the process, and the other is through the lens of decisions. So through these three lenses, we look to come to a fair resolution, and it also helps us to unpack where the problems lie in a particular complaint. Another aspect of the work that we do, which was anticipated before the office was open, but we didn't quite anticipate how much of this would make up our work, and that's in the navigation, helping Ontarians navigate what is a pretty complex healthcare system. As I mentioned earlier, our jurisdiction is not for the entire healthcare system, but a big portion of it. But for those areas where we do not have jurisdiction, then we would refer to the appropriate bodies that have jurisdiction over those particular areas of healthcare. And in particular, I'm thinking about if someone had a complaint about the clinical decisions being made by a healthcare professional who belongs to a regulatory college. So I'm thinking about doctors, nurses, occupational therapists, and so forth. Then we would refer complaints about their clinical judgment or their behaviors to those colleges that have jurisdiction over them. When we have findings in our work, particularly when it comes to formal investigations, we also share those findings with members of the health system so that we can do our best to prevent these situations from occurring for other people. So that ultimately, again, is what I mentioned earlier, the higher calling of an ombuds is to not only deal with the complaints on an individual basis, but to look where those complaints may be providing us with some insights that can help the system to change and do better, which helps all of us. And so that ultimately is the holy grail of ombuds work, is that we can take the power of the individual complaint and magnify it so that we can help many people across the entire system. So within healthcare, the complaints process can be a little bit complicated. And it's different for every sector. So the complaints process within long-term care is different than it is in the public hospital system, as it's different in home and community care. But we'll talk about obviously long-term care because that's what we're interested in today. And this is just a very quick kind of look at how a complaint may come to our office and what are the kinds of decisions points that we have. So we would be asking you when you come to our office, and this speaks to my earlier comment about being the office of last resort, is have you shared your concerns first with the administrator or the director of care at the long-term care home? Many times we've heard where a family member or a resident has made a complaint, maybe to a staff member, thinking maybe a PSW or someone who's one of the support workers. Ultimately, those complaints really need to be, if they're going to be taken up and dealt with by the organization, need to be made with the administrator and or the director of care. So that's really a formal articulation of an issue that you're having relevant to your family member in the long-term care home. So we will ask that you attempt to resolve your concern with that organization before we get involved. But ultimately, we do know that there are breakdowns in communication that occur, and we will work hard to reestablish a connection between yourself and the long-term care home and the senior administrators so that you can have your complaint dealt with in the appropriate way. We often do that through a courtesy call. So if you did come to us and you've had some difficulties having your concern taken up by an organization, then we would, with your permission, call that organization through a courtesy call and just ask if we can get you guys connected up. again, one of the things that I mentioned earlier is around jurisdiction. If the complaint is about the conduct of a regulated health professional, then we would refer that portion of the complaint to the regulatory college that has jurisdiction over that regulated health professional. So in long-term care, this could be a nurse, it could be a physician, physiotherapist, occupational therapist. All of those health professionals are regulated by their colleges. But having said that, if you've taken the complaint to the long-term care home, you're not satisfied with the resolution that you've come to, then we are the organization to come to, so that we can listen to what the complaint was, understand better what resolution was offered, and see if we can assist in helping to get a better resolution. So from that standpoint, we always say, if in doubt, just give us a call. Our team is incredibly adept at understanding where in healthcare you need to go if you have an issue, and also to help you to work through the best way to elevate a complaint within the organization that you're dealing with. So if that's the one thing you take away from today's talk, when in doubt, just give us a call and we'll be happy to help. So many of you might have remember that we issued a special report in October of 2020, and this was issued by Kathy Fuchs, our former patient ombudsman, called Honoring Voices and Experiences. And this was a special report that we released that dealt with the complaints that we received as part of wave one of the pandemic. So what we wanted to do was to make sure that we could communicate the information that we had heard in wave one of the pandemic so that we could prepare for wave two, and also try to ensure that the mistakes or the gaps that were identified in wave one did not occur in waves two and beyond. And so that's why we issued this report just on the heels of the original first wave. And I'm just going to go through a little bit of the high level data that came out of that report, and also some updated data that is from waves two and beyond, which will be making up part of our second report, which is due in a couple months, where we'll be talking about our COVID-19 related complaints from waves two and beyond, but for all three sectors that we have jurisdiction, not just long-term care. So in terms of the COVID-related complaints about long-term care, the data on this slide is related from March of 2020 to April of 2021. So this is really from the beginning of the pandemic to just last month. So it encompasses all waves. And in terms of the COVID-related complaints, when it comes to long-term care, 73% of our complaints were COVID-19 related. So that's a huge proportion of complaints being driven by the issues that the pandemic was driving within long-term care. And I think we've all been experiencing the impacts of the pandemic over the last year and a bit. And so this doesn't come as a surprise, but from our office standpoint, long-term care complaints did not make up the bulk of our complaints. So when the pandemic did hit, we saw a complete shifting in the proportion of complaints that we receive from long-term care versus our other two jurisdictions, which is hospitals and home and community care. And the fact that within those increasing complaints, 73% of them were COVID related, really was really indicated to us that the pandemic was, and we all know this, impacting long-term care in a very profound way. That left about 27% of our complaints in long-term care not being COVID related, but we do recognize also that what the pandemic did and the COVID-19 crisis in general was it encouraged many people to bring forward more long-standing concerns that they had about long-term care homes. And I think we've also seen that with the various special reports that have come out from the Auditor General, from the special commission that the province put in place, that there have been some long-standing issues and concerns in long-term care, and these were just amplified because of the COVID-19 crisis. And so those complaints we saw more and more within our office as well as a result. So again, staying on COVID-19 related complaints about long-term care, we always look at our complaints from the standpoint of themes, because this is where we want to be able to understand what is it that we're seeing in terms of emerging issues. So this allows us to be able to start tracking complaints in more of the aggregate way, so that we can then signal to the healthcare system that we're beginning to see particular patterns in our complaints, and that's a way for us to be proactive, to allow those healthcare organizations to respond in a proactive way based on what we're seeing in complaints, and not have to wait for a formal investigation on the part of our office or a report, because reports are always, a bit retrospective, and we really want to be able to impact the healthcare delivery as fast as we can. So in terms of wave one, which is the blue-gray panel, we received over that period, which is March to June, 239 complaints related to long-term care. And the way that those broke down, the top complaint was around infection prevention and control. So 43% of our complaints were about IPAC. And again, this has been reinforced by many of the reports that we've seen coming out from the Commission and from the Auditor General and other bodies, that infection prevention and control was an issue in the first wave. That was quickly followed by visitation. And for those of us who have loved ones in long-term care, I have 2 parents in long-term care, so the visitation piece, I can say from my family's perspective, was a large challenge in wave one and beyond. And so visitation was front and center as an issue, as well as poor communication and quality of care and treatment. Now those 4 issues continue to be the same top 4 issues from waves 2 and beyond. But what changed was the order in terms of the priorities. So while infection prevention and control was the highest, was the largest complaint theme that we saw in wave 1, and I think that obviously had a lot to do with the preparedness of the long-term care system to be able to provide the proper equipment to their staff, the training, and so forth. That was a huge challenge. But what we saw in waves 2 and beyond was that was no longer the top complaint or theme. And what really stood out to us was that the theme that really rose to the top was, again, visitation. And I think that also speaks to our own personal experiences, that once we got through the sort of the acute crisis of wave 1 and all that meant to everybody in the sector, waves 2 and beyond, it became about the visitation. And the other thing that I'll identify that we saw in terms of complaint themes that stands out to us is restrictions and isolation. And those go hand in hand with the visitation theme. So in wave 1, restrictions and isolation was only 1% of the themes, 1% of the complaints we saw. But in waves 2 and beyond, that rose rather quickly to 12%. So between the restrictions and isolation and visitation, that made up almost 50% of our complaints had those elements within them. And that really, I think, meshes well with what we know to have occurred within long-term care, where the restrictions to visitation led to the isolation, which led to the concerns that we had for people's health and wellness, and particular mental states, and so forth. So while the waves had some common elements to them, we did see this shift in the second waves and beyond, and that's something that we'll be talking to in more detail in our second report. So our office is in the business of stories. We listen to the stories from families about their loved ones in long-term care, and it's through the stories that we learn more about what is the issues in play and how we can help. But what we wanted to do with this slide was just talk about a little bit the breadth and width of the kinds of complaints that we heard. And they're all profound. And I think it'll resonate with many of you. Some of them resonate with myself. But these were the stories that we were hearing from families and caregivers about the situation in long-term care. So people would say, I'm afraid I won't be able to see my dad. Again, people were really concerned that the restrictions on visitation were having a negative impact, not only on their loved one, but on their own personal mental health. Who will help with feeding? Again, everyone was very concerned about if we didn't have eyes on the ground, if we couldn't get in to see our loved ones, then who's going to be able to help with feeding? Because that was something that we used to take care of. We worried they are all alone. Again, I think this is a common worry that we all had. From a communication standpoint, it was always very frustrating when no one is calling me back. Would be something we'd hear about. People had reached out to the long-term care home and we're not getting callbacks. So communications was a serious problem in wave 1. It improved in waves 2 and beyond, but it's always been our number one theme of complaints within all 3 sectors that we have jurisdiction, is around communications. And then as we would read more about the challenges that some long-term care homes were having around staffing, we would hear the stories about, I don't think they have enough staff. And this was because staff were either getting sick or not presenting at work, or were restricted from only working within one home and not multiple homes. So that was the underpinnings of that particular story. My mom is in the same room with another resident who might have COVID. Again, very much concerned about those situations where people were sharing rooms, either 2 to a room, sometimes 4 in some of the older long-term care homes. This was a very common and serious concern that people had about segregation of residents from one another for their own safety if one had the potential of having COVID. And then ultimately, the most horrible of stories is my dad died and I didn't get to say goodbye. And unfortunately, that was not an unusual complaint for us to have, which is really a heartbreaking scenario to have to think about. But it really was a profound time for everyone involved with long-term care, particularly the family members and residents. And that was reflected in the kinds of stories that we heard at our office, and had a profound impact on myself, my team. It's been a very challenging time, as you well can imagine, for everybody. So in that second report, we wanted to make some recommendations about how we could help to prevent similar situations from occurring in future outbreaks. And so in October, when we published that special report, which was based on the voices and experience of residents, families, caregivers, and staff, we came up with 4 policy recommendations. And these 4 policy recommendations were, 1, to provide for waves 2 and beyond, make sure that there's backstops and contingencies in place to support healthcare providers. And so, for examples of that would be to ensure that a long-term care home is paired up with a acute care partner, so a hospital, or it could be a community health center, so that they have a backstop in case they need to draw on expertise or draw on resources in the event that they found themselves in another situation where they might have staffing issues, or they just lack expertise in a particular area, particularly infection prevention and control. We recommended a change in approach to visitation. It was not enough to just close the doors and say no visitors. You can understand on a superficial level, allowing no visitors, it does appear to keep people safe, because no visitors means you cannot introduce into a long-term care home an infection from a family member or caregiver. But the impacts of those kinds of visitation policies were profound. not only on the residents, but also on the families. That the isolation that resulted, that the lack of stimulation and socialization had an effect that we're only now beginning to realize was probably more profound than we understood. And so we recommended a change in approach to visitation. And I can tell you from personal experience, again, with my parents being in long-term care, that the visitation has changed the policies have changed quite dramatically to where they are today. We also recommended dedicated resources for communications. So communications, as I said, has always been an issue in healthcare. We recommended that resources needed to be dedicated to making sure that policies and directives were communicated appropriately to family members so that they understood the rules, because ultimately we all want to follow the rules. We all want to keep our family members safe, but we need them to be communicated in a way that we can understand them. And so ambiguity is never good in those situations. We need clarity. And finally, the recommendation we made was more protection for whistleblowers. So whistleblowers are staff members who raise concerns about issues within their long-term care homes. And the provisions that protect staff currently within the Long-Term Cares Act, we feel are not strong enough to allow them to be able to speak freely about what they're seeing in their homes. And I think that's an important aspect that will be followed up with legislation, would have to be followed up with a change in legislation by government. So a little bit about where we are in terms of our current work in long-term care. We continue to respond to COVID-19 complaints and non-COVID-19 complaints. And our caseloads are at record highs. So that rise in complaints that we saw at the beginning of the pandemic has continued throughout the entire crisis. And so our caseloads are as high as we've ever experienced. We have also initiated a systemic investigation in June of last year into the resident and caregiver experiences. And so we are continuing with that investigation. And we are doing, part of that investigation is to do a deep dive or a more comprehensive look at 3 to 4 homes that managed an outbreak of COVID-19. And as part of that investigation, we are launching a provincial survey, which Sam mentioned off the top of this webinar, to gather additional feedback from families and caregivers, residents and staff. And each of those different audiences has a separate survey. So I'll have more to say about that at the end of this session, but really encourage you to fill out those surveys, to assist your family members who are residents to do those surveys, because it's an important aspect for us to be able to get a broad understanding of what people went through across the province. And that special report that I spoke to, which will look at waves 2 and beyond, and covering all 3 sectors of our jurisdiction, will be due out this summer. And we continue to do ongoing engagement and awareness with family councils, with residents councils, and we are always happy to attend webinars like this to make sure that you are aware of our office and what we can do to help, and that you can pass that on to your friends and family so that they also know about our office. So I mentioned that we have a systemic investigation underway, and this is just a little bit of an update on that investigation. So we are investigating long-term care homes that experienced a COVID-19 outbreak. So not all long-term care homes had an outbreak during the crisis, so we are looking at the homes that did and how they managed it and what impact that had on the lived experience of the resident, the families and caregivers, and the staff. So our investigation is focused on looking at those visitation restrictions and protocols, the communications, including the timing and the type of information that was shared with residents and families, the staffing levels over the course of the outbreak, infection prevention and control practices and protocols, and access to personal protective equipment. So those are really some of the focuses of our inquiries, but we are also broadly looking at those homes in terms of their response to the various outbreaks that they would have had to manage. The next steps in our investigation are that we've done witness interviews and what we call document summaries. So we've requested quite a bit of documentation from the homes that we're investigating, and we are now in the business of analyzing and synthesizing that information to gain insights. And we'll begin the process of writing that report and issuing recommendations in the next couple months. Part of that of a typical investigation is once we get to a point where we have a draft report, then we always offer an opportunity for those organizations that we are investigating to provide feedback and a response, because ultimately we don't want people to be blindsided. It doesn't mean that they have an opportunity to change what is in our report, but we always want to make sure people are aware of what it is that we are speaking about. And we'll be issuing that final report to government, long-term care home sector, and the public in early 2022. So the investigation is a much longer undertaking for us. It's a year-long type of undertaking. So that's what we will deliver and finish in early 2022. But we want to also be, as I said earlier, be proactive and deliver a second report, special report on the COVID-19 crisis in the summertime that deals with waves 2 and beyond. So speaking a bit more about that survey, we want to know about everyone's experience in long-term care during the COVID-19 crisis. So that's why we're asking all family members of residents in long-term care, all residents and staff and volunteers to complete the survey, the three surveys that one of the three surveys that we've created, so that we can get a really good sense of sort of the broader experience that occurred across the province. We know that we could never investigate all long-term care homes across the province. It probably wouldn't, it just wouldn't be feasible. But we also recognize that we want to gain the insights of everyone across the province, and not just the homes that we're actually investigating. So that's the impetus behind creating these surveys. And so far we've had tremendous uptake in these surveys, and we're really heartened by that, because we obviously we knew that there's more stories to be told than we had heard, and so this will really be helpful for us to be able to have a really fulsome and comprehensive understanding of what people went through over the course of COVID-19 in long-term care. So this province-wide experience survey is anonymous, and so we want to make sure that people feel comfortable being able to share their stories. Not everybody is comfortable complaining, and we know that. That's always been something that we recognize occurs in our work, is that generally people don't like to complain, and they certainly don't like to complain when they're complaining about healthcare, because, as I said earlier, healthcare is a very intimate service provided by people that become family members, particularly in long-term care. As I said, these are our loved ones' homes, and those people providing care are family members by extension. So we don't really want to complain. So by allowing people to voice their concerns and talk about their experiences through an anonymous online survey, we feel that we're making it a safe space for people to actually talk to us about some of the things that they experienced and witnessed. And so that's why we've taken that approach, in addition to doing the regular work of interviewing residents and caregivers and family members from the homes that we are investigating. So as I said, these surveys are anonymous, and so it will to encourage people to share their stories. But we also recognize that online surveys are not everyone's cup of tea. It's not easy for everyone to gain access to the technology. They're not always the simplest things to do if you're not particularly familiar with how online surveys work. So our office is more than welcome, or more than happy to provide any necessary accommodations that you may have to support residents family members, whoever that needs to be able to gain access to a survey, and they want to have their voice heard, then I encourage you to call our office, and we'll make arrangements, whatever they need to be, to allow us to get that particular voice of a resident or family member, so that it can be part of our study. And as I said, the findings for those surveys will be released in the fall of 2021 this year. So while it's part of our investigation, it's not bundled into the formal report that will be in 2022. So this information will be coming out sooner than that final investigation. So I'm just going to try something to see if I click on this. I'm not sure that you will actually be able to see the survey. If it doesn't work, just let me know. I'm not seeing it. You can tell me if you see the survey.
I don't see it right now, Craig. I think you might have to maybe click the share screen option and then click the new window that you have to open in.
Okay, I'll stop sharing, then I'll share again. And do you see that?
Yes, perfect.
Okay, so this is the page on our website that has the 3 surveys. It's down here. We have the links to the resident survey, the link to the family and caregiver survey, and the link to the staff member survey. And staff member can also mean volunteers as well. So I'll just click on the I'm a family member link. You'll be taken to the survey for family members and caregivers. And we tried to keep it as simple as possible. It is essentially multiple choice. There is an opportunity at the very end for some free form text, but we wanted to make it as simple as possible. And you just essentially go through the questions. There is a few. Again, we're trying to be able to gather as much information as we can. So I'll just go to the bottom, just let you know for the family and caregiver survey, there are 46 questions. So I would say it would probably take you 15 to 20 minutes to do the survey at tops. But we really would encourage you to do the survey, because this is really going to help us to really understand the full breadth of the experience that people had in long-term care over the course of the COVID-19 crisis. And as I said, we're having some fantastic uptake, particularly from families and caregivers, even residents and staff. So we're really excited by the results, and we just want to make sure that we get as many people made aware of this, and that they can share their stories with us. So that is the end of my slide deck. So thank you for your attention. I hope I didn't drone on too long. I see I was 45 minutes, but happy to take any questions now or provide additional insights into some of the things that I mentioned.
Thank you so much, Craig. I think that was a wonderful presentation, lots of insights. And thank you as well to Senior Communications Specialist Jason, who's been actively responding to some really great questions that some attendees have sent privately to the panelists. So thank you so much, Jason. I will try to get to some of the more general ones that I know will be beneficial for everyone to have insights on. Also, just a quick note, we are recording the presentation, and the slide deck will be made available as well. So we'll be able to share that with attendees or and individuals that weren't able to sign on today. So I will just start with a quick question based on some of the common things that we're hearing from families. So we do know that their experiences are very integral to informing and shaping the sector. Do you, Craig or Jason, have any suggestions for how family members can get their concerns past the local level, I'd say in the short-term span?
past the local level in terms of past the, like beyond their own long-term care home?
Yes, and possibly even public health units, things like that as well.
Well, I would say from the standpoint of our office, that if there's a complaint in that you want to be able to advance, that you're not satisfied with the response that you got from the home, then obviously we encourage you to come to our office. But from beyond our office, to be able to inform the sector, there's a lot of people with a lot of interest in long-term care now, and anything that family members can do to raise awareness of the issues that they're seeing based on their own lived experience with a family member in a long-term care home, they should do, and that includes speaking to your local public health unit, speaking with the your NPP. Ultimately, long-term care falls within, it's a government service, and so the Ministry of Long-Term Care has purview over the delivery of the services in long-term care. So through your MPP, that's another way to make sure that your voice is heard as to specific issues. I think that's, generally the more that you can share your experiences, not even with people that aren't really involved with long-term care, because ultimately we all will be involved with long-term care in some form or fashion. It's a conversation that we need to be having, not only with within our own circles, for those of us who have family members in long-term care, but beyond. Sometimes hospitals take up all the air in a room because of how much of a bigger system they are, but ultimately long-term care is really an integral part of the healthcare system in Ontario, and we need to make sure that conversation continues.
Okay, thanks for that information. I think it's something our team has also suggested in the past as well. It's there's a lot of creative ways families can get involved. Quite a few of them participate on committees. We have a few on our advisory panels as well. So we encourage you all to, continue getting the word out there, sharing your experiences, participating in this new survey will definitely, help inform the sector as well. So we have another question. I'm just going to scroll up a little bit. In the special investigation, will we be using data collected by the Long-Term Care Commission on staffing levels during the pandemic?
It's a good question. Right now, I'd say probably not. As part of our investigations are quite separate and distinct. And so through our investigation, we have the ability and the power to request that exact same information. So we are looking at staffing levels during outbreaks and how those homes managed those outbreaks. So we will have that information. Obviously, we read voraciously the Commission's report, but right now we have the same ability to access that information on our own through our own powers.
Okay, perfect. And there were some really great comments and questions all throughout the presentation. I know Jason was a whiz on the keyboard getting to most of these. So I'm just going to scroll up a little bit more and make sure we can get to any other comments or questions. Okay, so a quick one. Are there any parameters to ensure that no one is able to, I guess, complete the survey more than once?
I would say yes. One of the things, though, that we, in terms of doing a provincial survey, we recognize that there will be situations where multiple people will be doing the survey from the same machine, the same computer. So the typical systems that sort of stop that from happening, we're not using, because we want to make sure that if there's like a common device that people are using for surveys, that people could do that. But we do have other ways to be able to identify if there is like an unusually large number of complaints coming from one particular device, and that would be a flag for us that maybe a survey is being overused, if I can put it that way. So that's one way that we'll be able to look at it. I hope that answers the question.
Yes, I think it does. It's good to know that it will be analyzed in that way. We do have another question. How do we get these surveys to the residents and employees as well? Would there be a channel to maybe contact the long-term care homes to be sending out these surveys? Or should the families be sharing the links and information with their homes?
Definitely encourage families to share the links with their circles and their family members. But we're also reaching out to the residents' councils. We also have done an email out to all long-term care homes, their administrators and their senior administrators, so that could be shared with the residents and the staff. So we're trying to find multiple ways. Jason's doing an amazing job of reaching out to all sectors that we can that would have an interest in these surveys, and making sure we get a broad exposure to the fact that this survey exists. But I would always suggest, that we all, if we share this link with our friends and families, so that everyone's aware that we're really looking for input from residents, for sure, family members, caregivers, and staff.
Perfect. That's a great suggestion. Our team, we do know that family councils are meeting virtually right now amidst COVID. So if you are meeting virtually with your family council during this time, please do share this information. So members that aren't on this call today can also submit their information and their experiences into the survey. I have another question here. So we've heard it as well. There have been, a few complaints in regards to the wait time for the action line, so a response from someone at the ministry. We know that, people can call directly to the Patient Ombudsman to share their complaints. Is there a specific timeline based on the type of complaint?
In terms of the action line?
In response to the Patient Ombudsman, getting complaints and then responding to them.
So what we strive to do is respond within 24 hours to either an inquiry or a complaint. Because we want to understand, first of all, is it a formal complaint, or is it something that we can deal with as an inquiry, or is it something that we can just provide some information to get you to the right person? So we strive to respond within 24 hours. In terms of the response when it becomes a formal complaint, every complaint, I hate to say it, is unique, and so there's really no one sort of timeline. We do overall, over the course of the thousands of complaints we've had, we look at being able to get to resolution of a complaint within 120 days. So within, or just under 120 days. But it's also, if we can find a way to move the complaint along quicker through these courtesy calls or reaching out to a long-term care home so we can start a dialogue, then we will take that choice. The quicker we can get to a complaint, the quicker that we can have a conversation as to understand what it is that is the main issue, the better resolution that we can get to.
That's some great information to have, especially with the turnaround time. So yes, please do reach out to the Patient Ombudsman if you feel that your complaint or concern is something that they could go over with you. We do have, I will try to grab a couple more questions before we sign out for today. So you did mention some of the common issues that families cited as, some of the barriers when it came to communicating with their long-term care home or seeing any change. Does the Patient Ombudsman Office have any authority to change the systemic format, to create federal or provincial mandates, or give a bit of a push on making sure that some of these barriers are gone?
So ombuds offices do not have the power to compel people or organizations to follow any of our recommendations. But where the power of our office lies in our ability to go public with it and to influence those organizations and to make sure that government is aware of the issues that are presented. What makes us unique is that we are driven by the voice of the resident and families and caregivers. That is our source of the insight, and that insight is the most profound because that's what matters to people. And so when we speak, we're coming from that place. We're coming from the voice of the individuals on this webinar, from all the different residents and family members across the province, and that carries weight. And ultimately, when we deliver our reports, and particularly when it's a formal investigation with formal recommendations, and those recommendations go to the government, then it's backed by the weight of the fact that these are people telling us their stories, and it's also representative of, while only one, not everybody complains, but behind every one complaint, there is a group of folks who didn't complain, and so we know that it has the weight from that standpoint.
And I'm just scrolling for a couple more. We have a great question here. Before a restriction or guideline or even a directive is implemented, do you have any suggestions on how families can have better input or local individuals can get their voices heard in terms of informing some of the policies that we see coming out?
Well, I think it's always good practice to engage your stakeholders before you deliver any kind of policy or change in practice. I know that the COVID-19 crisis has made the ability for people to engage really challenging. And I think maybe in pre-COVID, family councils, residence councils were part of that stakeholder engagement when policies were looked at, and we had the benefit of time to be able to think these through in a comprehensive way and to engage people properly. I think what COVID did is we lost that. Not only did visitations impact our loved ones in long-term care, but family councils couldn't meet. Some family councils were completely canceled, and that was probably all done for the right reasons at the time, but that is not a way forward. You can't isolate your stakeholders if you're wanting to deliver good policy. So we would always be recommending to long-term care homes that while it may be more difficult, you need to get creative and you need to continue to engage your stakeholders, which includes family councils, before you release policies or change practices. That's just good business.
I think that's a great note to probably end our webinar on, especially because we've seen so many of our passionate family members endure so much over the last year and a half. A lot of them still remain hopeful that they'll be a part of changing the sector and improving it for residents. But we do have to share our appreciation with you and your office, of course, for being, a stakeholder that we can rely on for some great feedback and insights, and that you're listening to residents and families and staff as they, endure what we're going through right now. I will say that Jason has been really helpful in providing the link to the survey. He did say that we are almost, I believe, at the survey goal. There's about 950 completed surveys, and
Nice.
the goal is going to be 1,000. So for any of you on the call today, please do submit your insights on this survey. What you have to say matters, your resident matters, and we want to make sure that we're informing change and improving the sector. So with that being said, again, this is recorded, so we will have it up in the next few days, as well as the PowerPoint slides, but please feel free to reach out to the Patient Ombudsman directly if you do have any concerns, complaints, or even questions that you want answered. And our Family Councils Ontario team is always available as well to assist in trying to either triage some of your concerns or answering any questions that you might have about family councils. So thank you so much. Craig, do you have any closing words? I'll pose that to Jason as well. If there's anything else you'd like to say before we end our webinar today.
No, just it's been a real pleasure to speak with everybody today, and just I admire the work that Family Councils Ontario does and all the family councils across the province. it's hard work, it's worthy work, and thank you for doing it.
Thank you. We appreciate all of the support and look forward to future collaboration. So thank you. Everyone, wishing you a very safe and hopefully sunny afternoon where you are. Please take care, stay safe, and continue to reach out to our agencies for support as well. Have a great afternoon, and we'll see you soon.